My name is Carolyn Sturge Sparkes. I'm the coordinator for the Aboriginal Health Initiative here at the Faculty of Medicine, Memorial University. So when we started this initiative in 2008, the primary mandate was to recruit Indigenous students into medicine. So I was hired to establish these pathway programs. So we've developed these different programs to attract students, if I can use that term, into medicine. And we started off with programs for students already who had arrived at university from the first year of their undergraduate program up. So with a pre-med orientation, which included a mentorship component where medical students would be mentors to the students. Then once the students get to their third year, we offer the Pre-Med Summer Institute for students to have a more intensive experience within a clinical environment. And they also, as a part of that institute, receive training in how to prepare for the interview for medical school and other things they will need to know, for example, writing the MCAT and so on. Then we also offer an MCAT prep grant for students who want to write the MCAT and would like financial assistance in doing that. And as the years progress, we realize we need to move deeper into the communities and to connect with students prior to coming to university. So for the second summer, this past summer, we offered the Healers of Tomorrow Gathering, which is a healthcare profession camp for Indigenous young people. It's still in high school, who are thinking seriously about one of the healthcare professions. And we also have elders and healers and representatives from the community attend the camp as well. So side by side, as the students learn about the westernized healthcare professions, they also learn more intensively about the knowledge from the various Indigenous communities about health and healing. So that's the recruitment component of the program. And then for medical students, we also offer courses or sessions in Aboriginal health and Indigenous health. We think that that's very important for the medical students to increase their knowledge within the undergraduate medical program. So the primary objective for the pathway programs is to recruit Indigenous young people into medical school. For students, once they are in medicine and the components of the curriculum, we want to expand their knowledge, first of all, of who the Indigenous people are, because it's amazing for students, non-Indigenous students in particular, the level of knowledge about the Indigenous communities is very minimal. So to teach them about the different Indigenous groups in Canada and as well, for example, more specifically within Newfoundland and Labrador. Students are still very confused about who Inuit are as opposed to Innu. They get confused about these different groups. So we want to expand their knowledge about that. And for example, to look at the realities of the Indigenous populations. Not that we want to call them vulnerable. I don't like that term, vulnerable, because my view is that Indigenous people aren't vulnerable because they're Indigenous. They're vulnerable because of what has been done to the communities over the years. So it's important for the students to see historically the impacts on the Indigenous communities, which have resulted in the conditions that we see today as far as health status and a sense of well-being is concerned. But that having been said, we also want to highlight the resilience in the communities. So for that reason, in the sessions, I invite Indigenous guests to come in to speak to the students, because I'm not an Indigenous person myself, I'm a settler. So I think it's important for the students to hear the voices of the representatives of the Indigenous communities, so they can hear from them their view of these things and their lived experience. I think it's, first of all, when I took this job in 2008, I was very, very careful to build a relationship with the Indigenous communities. And also, for example, with the board that advises me about the initiative and what we decide to do. we have representatives from the communities. So over the years, we've nurtured that relationship, and I think that it's very, very important to have their voices within that. I think that their contribution to my way of thinking and building that relationship is of primary importance. So if anything, that would add to that example of building relationships. And now, for example, the input from the community is becoming stronger and stronger. And I think that for that reason, that would be the overall example that I would think would be exemplary of the communities, knowing full well that that's taking place across Canada. So we can't claim that we're the only ones doing this, but for us within this microcosm, it's extremely important. Well, first of all, success pathway with the number and caliber of students who are applying to medical school. Since we've set aside now 3 seats, and since 2011, we now have 31 students who have been admitted into medical school. Not only here at Memorial, but some of them have gone elsewhere to other medical schools. And I'm very proud to say, and this is under advisement from the Indigenous representatives, for example, they were very adamant that we don't create an affirmative action. Now, affirmative action does have its place, but they were very adamant that they want the students who are accepted into medical school to academically be at the same level as non-Indigenous candidates. So I'm so proud to say that these students have come in here, and not only have they been accepted into medical school, the ones who attend Memorial, but they've accepted numerous awards. So I think that highlights, and I include that in the PowerPoints that I present to people to show them that we're not accepting students by the mere fact they're Indigenous.
Right.
They're highly capable students, and as you can see from the awards they do get while they're studying here, that certainly exemplifies that. Well, Indigenous education to me is an opportunity for non-Indigenous students, as well as the Indigenous students, to hear the voices of Indigenous people, that how they want to shape their destiny, as far as, building capacity within their communities, and how the non-Indigenous people, of the settlers, if I can call them that, can become allies to address the discrimination and the racism and the structural violence within the different systems, like the healthcare systems, and to build that so that we I shouldn't use the word that Indigenous populations take the lead on what they want to define to determine their destiny, and how we can become, like I say, allies in order to address these levels of discrimination that currently exist within the systems. So it's looking at a very broad perspective, not only the current situation of Indigenous people, but, for example, what we can do within the society to help, reshape the direction, and to help them to develop that autonomy within their nations, to determine their destiny. And it's a two-way street. What we can learn from Indigenous people, their knowledge about health and well-being, that we can carry into our healing processes to improve upon it. Because Western medicine does have its strengths, but it also has its weaknesses. And we can certainly learn from Indigenous populations to enrich that. Well, number one, I'd certainly like to see a greater presence within our undergraduate. This is like an ideal situation.
Absolutely, yeah.
Because you can appreciate that there's always competition within curricula, what should be included and not included. So I would certainly like to see an increase in the presence of Aboriginal people participating in the curriculum. Certainly an increase in Indigenous faculty. I think that's extremely important, and that needs to be a strength going forward. And a presence, for example, and of course with the medical students who are graduating from Indigenous communities, that they can have a greater presence in helping to develop the curriculum, and to see much more of an integration within our medical curriculum, an integration of medicines, for example. I know some Indigenous people don't like the word traditional medicines, that they don't like that phrase, but to see more of an integration in the curriculum, to show that there's real strength of knowledge and a robustness within the communities that non-Indigenous people can learn about. Approaches to healing. It's so important. For me personally, I would like to see an expansion in the personnel of the office here. And of course that's related to funding. And I would say that just a general knowledge and awareness within the faculty of the strengths within the communities and what the Indigenous communities have to offer, that we can combine and have their presence a lot more profoundly highlighted within the faculty. So that's what I would like to see. That's within the faculty, but within the entire university. And of course, having an Aboriginal People's House on the university level would be so important to add to that presence within the university.